This video again I'm discussing a recall communications. It is come on 2019 and the task was teenager with hypertrophic obstructive cardiomyopathy that died of hypertrophic obstructive cardiomyopathy. His recent scan showed that worsening of the hypertrophy. Wants to play basketball. Task is talk to him. So it is a teenager scenario, very difficult scenario. He wants to play basketball but he has HOCM. Here, actor kept looking at phone, difficult to establish the repo, managed to tease out that he was not compliant to medications but could not get him to be interested in my explanation. Repeatedly shrugged and said, I want to play basketball. I felt this was a bad station. Examiner feedback, you asked too many questions and did not have time to explain. And you should have explained more about the hypertrophic obstructive cardiomyopathy. So that is as usual introduction. I at CAP introduce myself, repo, taking the consent, agenda, attendance and prior knowledge. The child was busy at the beginning of phone, then we will tell that can you please down the phone, I want to talk you, it just take the 9 minutes. If you want you can count that. Just 9 minutes. Then we will start the explanations. We will draw a pictures. Imagine with me, this is our heart. And our heart consists of 4 chambers, 2 upper receiving and 2 lower pumping, and 2 main blood tubes. One from the right side, it carries the blue blood low in oxygen and to the lungs, which is called pulmonary artery, and one is from the left side, which is carry pink blood rich in oxygens. To the other part of the body, it is called aorta. So we'll draw a pictures of that 4 chamber of the heart. Our heart consists of 4 chambers. 2 upper is receiving and 2 lower is pumping. Okay. And also there is a right side blood tube which is called pulmonary artery. It take blue blood from the lungs, and left side there is also an artery, a very big blood tube that is called aorta, which carry pink blood from the other parts of the body. So in Adam's your condition, so we draw 2 pictures. One is normal heart, another is the hypertrophy of obstructive cardiomyopathy. In Adams, your condition, left side muscle become thick, stiff, irregular and distorted. So the left lower chamber will be smaller and cannot pump enough blood to the body, and the doors become leaky. So what happened? We draw the pictures. Hypertrophy of the cardiomyopathy. There is left lower chamber that is very much thick. The muscles are thick. The chamber is smaller. That's why it can't pump the enough number of the blood. For that reason, there is pressure occur in this. It cannot be cured. If asked about the treatment, what can we do? It cannot be cured. Has impact of life and daily activities. Some children without symptoms. Others may have conduction problems diagnosed by the jelly scan to record the electrical activity. So it is not curable, but it affects the lifestyle. So that's why actually he wants to play the football. We are telling that he can alternate. We can tell that indoor activity, game. These are we can offer. Treatment is heart doctor will give the medicine to improve the ability of the heart to contract. Lifestyle modifications. Some children may need surgery, septum myotomy of the thickened myocardium. Others may require pacemaker. So some people take the pacemaker needed, some people need surgery. Heart doctor will explain you the management, but lifestyle modification is also one of the treatment advice. Treatment advice I am giving for hypertrophy obstructive cardiomyopathy is lifestyle modifications, avoid the vigorous exercise, avoid alcohol and smoking, stuck to his follow-up and the heart clinic, screening to the other family members as it runs in the in some families, and early detection and management has better outcome plus cardiac advice. Prognosis sudden infant death. So as some advice I will give the lifestyle modification. You will be avoid vigorous exercise, avoid alcohol and smoking, start with the follow-up. These are cardiac advice. We know that hygiene maintain, good nutrition take, avoid any tattooing, piercing of the body, regular follow-up, and also he will be vigorous exercise like playing basketball. You one of the vigorous exercise he should need to be avoid. So this is all about hypertrophic obstructive cardiomyopathy communications. Thank you very much.